So maybe at this point I will ask you a question about the data that you presented here at the meeting. So you presented a subgroup analysis of the FLOR trial, which you presented before, but now the patients that had progressed rapidly, that had received oxaliplatin only in the adjuvant setting and had progressed within 6 months of receiving that adjuvant oxaliplatin were removed from the trial population. And can you comment a little bit on the results?
Yeah, we know that patients, if they have a rapid progression, that this may be a specific subgroup, and therefore we looked also in this study, and the FLOR study indeed included some patients with rapid progression who were treated with oxaliplatin-based chemotherapy in the adjuvant setting, and then had an earlier relapse. And looking into other databases and other publications, we know that these patients have a worse prognosis, but they were included in the FLOR study, and this is not the case in all different studies. So when looking then further in the data of the FLOR study, FOLFIRI plus or minus aflibercept, and excluding these rapid progressions, patients with a worse prognosis, we saw that the difference in favor of aflibercept in the patients was a bit bigger for as well progression-free survival as survival. And the hazard ratio was a bit more favorable in that sense that if we excluded these rapid progressions, and that was only a minority of the patients in the study, then the hazard ratio for PFS becomes more favorable, and the hazard ratio for survival becomes more favorable. And that brings a bit in perspective some of the data and the activity of aflibercept, because in the general trial, in the total, in the ITT population, there were patients included with a worse prognosis, which was not always the case in other trials. Of course, we have to be careful with doing cross-trial comparisons, but in clinical practice, if you're faced with a patient in second line, we have always to look and to take a decision. What should we do? And what do we want to do? And therefore, some of these data may help us. They're not rocking science, let's say, the subgroup analysis, but they may help us further to understand.
They refine our populations.
And they refine the populations.